I'm a patient rep. Tomorrow is my anniversary. 5 years ago, about 3 hours from now, 5 years ago, I was in an ambulance going to the hospital in Edinburgh, having just had a heart attack. Completely out of the blue. I was pretty fit then. I was a lot slimmer then. I did smoke though. But the next thing I knew, I was in an ambulance going to hospital, had a stent fitted, and went through the system, and very impressed with the system. I was keen to give something back, so I got involved with the local managed clinic network on the subcommittee. And I think I went to 2 meetings before it was disbanded. And it's a bit of a bone of contention, but Edinburgh, Lothian no longer has a managed clinic network for heart disease. However, I went along to a chest, heart and stroke seminar called Hearty Voices, which gave you the tools to interact with the health service, and in a positive way. And at the time, having gone through briefly phase 1, phase 2, phase 3 of rehab, cardiac rehab, I was bereft of anything to do after that. It's a very good system, and for 10 weeks they take you through exercise, and then you're on your own. There were what we call phase 4 groups in Edinburgh at the time, which I joined. Excellent. However, they disbanded as well. So at the time I met Nicola Cotter, who is somewhere, way at the back there. So we got together and decided we would try and organise more groups within the Lothian area. So where are we there? So I became a community support volunteer for chest, heart and stroke. And that led to me going around a lot of the phase 3 cardiac rehab classes in Edinburgh and the Lothians, meeting a lot of people. And what with the overwhelming desire to carry on exercising and the overwhelming appreciation of the National Health Service, it was decided I should do something a bit more upmarket, shall we say. And I was put forward for the National Advisory Committee for Heart Disease as a patient rep. Now, that is quite a high-level group, and I am the only patient rep on that group. However, with support from the Scottish office, who give me a patient briefing before I go along, I'm managing to make my point whenever I can. Perhaps one of the most rewarding things I've been involved in was a pathway redesign for Lothian for cardiac rehab, where I actually went with the cardiac nurses, the consultants, the cardiologists, and we sat down and over 2 mornings trying to remap the integration program. And I actually felt I was giving something as a patient and also as a patient rep. Part of the problem being a patient rep, especially one who's 5 years down the line now, is keeping up to date. Because I need to support people who I knew well 5 years ago. I went through the system, but now I'm almost out of date. So I have to go around regularly to meetings, to phase 3 groups, and any other courses going to talk to patients. And I always encourage patients to come and tell me their issues. Another problem I find is most patient reps, most interactions tend to be people like me, for want of a better description, middle class, white, and quite happy with the system. And I do try to get other people involved, but it's much more difficult, as I'm sure you're aware.